Before we go ahead with our series on basic clinical techniques, I felt I should take a step back and talk about the importance of good record keeping, because it is one thing to perform these techniques correctly, and it's another thing to record properly. You're welcome to Island Academy. My name is Dr. Oketa. Island Academy is your ultimate resource for optometry success. If you're a student or a practicing optometrist looking to deepen or to sharpen your clinical skills, this channel is the place for you. We are required to be detailed about our clinical records. Our record keeping should not be found wanting. What are the things that comprise of a good record keeping? First of all, you need to make sure that your patient's record has the patient's full name, has the patient's date of birth, and the patient's ID number, if applicable. These three things are very crucial. The patient's name, first of all, your patient's date of birth, and your patient's ID number. And when you're recording, you need to ensure that you tuck it back into that patient's folder and not mixing it up with another patient's folder. Or if you are using the electronic means, you ensure that the page you are typing on or the page you are recording these details on are for the particular patient in question, because mistakes can happen, and we're trying to avoid mix-ups here. When you ensure that those things are in place, you need to take a detailed case history. This is not a video for me to talk about how to take your case history, but I'm just letting you know that if you take your patient's case history, you need to be very, very detailed. You need to know about the patient's general health, patient's previous health history, patient's previous ocular history, patient's family history. All those things are important. But in recording the patient's reason for visit, you need to record it in the patient's own words. Avoid medical jargons. Also avoid abbreviations that are not common or abbreviations that are not professional. Summarizing this patient's concerns or taking down this patient's concerns will help you and other healthcare practitioners to understand the patient's issues clearly. It will also help you to monitor your patient's progress. Another importance of it is that if you are off duty and someone else is on duty, it wouldn't be difficult for this person to track the patient's history or to track the patient's details of treatment. Why is it important that we maintain proper record keeping? It helps you to defend yourself just in case you are sued for any reason. If you do not record properly, then you don't have anything to defend yourself with. Now let's talk about recording your examination findings. This is one of the most important apart from the case history. You need to describe every clinical finding in detail. If you find any abnormality, I mentioned this in the previous video I made on ophthalmoscopy, that if you find any abnormality, you describe it properly. If you need to draw, you should draw. I also said that you shouldn't write NAD. NAD doesn't mean anything. There is nothing professional in writing NAD. If you're taking your patient's visual acuity, you ensure you record it properly. There's nothing like normal vision or good vision. Make sure you take your visual acuity at far and at near, with the patient's habitual prescription and without the patient's prescription, which is the same as aided and unaided visual acuity. This is very important. If you measure your patient's intraocular pressure, write the method you used. If it's a non-contact type, if it's the contact type, you write it. And don't forget to write the time this test was done. If you have to do the contact tonometry, you need to ensure you write the type of anesthetic you used, the concentration, the expiry date, and the time that you used it. And remember that you have to obtain consent from your patients before you carry out some of these techniques or some of these tests. You need to write that you got an informed consent from your patient. In case your patient turns down any test or any treatment, you need to ensure that you note it down. And when you write it, always write your suggestion or your advice to this patient. Now, when you have all these things in place, it is easier for you to follow up your patient or when you are not on duty and your colleague takes over from you, it is easy for your colleague to understand what you have done. When you finish attending to your patients, always make sure that you write your diagnosis. This is very important. When you write your diagnosis, you write your treatment plan. What have you done for this patient? Did you refer this patient? Did you recommend glasses for this patient? Did you recommend eye drops for this patient? Is this patient going for vision therapy? Is this a low vision patient? Are you the one managing this low vision patient, or you want to refer this low vision patient to a specialist in that area? These are all the things that you need to put down. If you change your patient's prescription, drug prescription, eyeglass prescription, you need to indicate that you changed it and the reason for changing it. Now, let's take a look at the ways of appropriately documenting your patient's details. This is what it looks like. I made up those patient's details. So everything I've mentioned in the video, you find them here. So this is just like a guide for you to just understand how to record your patient's findings. Depending on where you find yourself or where you're working, some of them may have their own template. So you just make sure you fill in appropriately. If you like this video, click on the like button, share and subscribe.